I think kids' mental health needs in Alberta are rising faster than our services can respond, and that's evidenced by the increased acuity of presentations of children's mental health conditions, along with the growing population, and in a way it is impacted by our focus on reactive rather than proactive services to that population.
What I'm seeing as the CEO of CAS is more kids coming in who are not only struggling with social challenges, maybe family challenges, but also with the ability to just manage their emotions. The thing is, we can't just say it's there. We have to do something about it.
Fundamentally, the real challenge is how do we keep people out of the acute care setting? So we might say, just as a rough estimate, there's about 2 million people in Alberta who will experience psychiatric illness. The 40-40-33 rule says that of those 2 million people, only 40% will receive any care whatsoever for their psychiatric illness. And of that group, only 40% will receive what we would consider to be an absolute bare minimum standard of care. And of those, only a third of them actually achieve remission. And the sad reality right now is we don't have nearly enough psychiatrists to treat all of the people with psychiatric illness.
CASA Mental Health is playing an important role in meeting the emergency that we're seeing arise in children's mental health all across North America and here in Canada. 1 out of every 4 kiddos, approximately, who access emergency services will do so because of a mental health reason, and therefore this emphasizes the much needed work that needs to happen to keep them away from emergency services and to provide that care before it becomes a crisis and an emergency. We're doing very exciting work as part of the CASA Research Chair in Child and Adolescent Mental Health, because this has positioned us in a unique spot to address the growing needs of people with autism and neurodevelopmental conditions in a way that can be increased and extrapolated from that work to meet the needs of several other kids. So our focus has been on trying to enhance the healthcare that people with those diagnoses receive. And to do so, we're focusing heavily on our research efforts, but also building on educational initiatives, developing new clinical services, and engaging very closely with the community to put forward advocacy efforts around the growing role of genetics for these conditions. And it's a very heterogeneous landscape, so it's very important for us to be able to do genetic testing to identify those causes and then to leverage that information to enhance healthcare.
So what is next for CASA Mental Health? It's going to be exciting. We are really working hard to listen to our communities, and what we hear is we need to continue to be closer to where kids are. We have 28 classrooms across Alberta, and we're going to be increasing that number, which we're really excited about, working with our school divisions. And we're going to build 4 CASA houses. So Fort McMurray, Calgary, Medicine Hat, and eventually Edmonton.
Clark Builders has always been a big community supporter. And about 10 years ago, 2016, we had an opportunity to partner with CASA and build their first facility. And so that's just been such an impactful opportunity, not just for CASA and for Clark Builders, but for the communities that we serve collectively. And right now we're working with CASA on the capital expansion project. It serves not just the local communities, but it'll serve the entire province as that when the entire project portfolio is complete, which means thousands and thousands of families will get the benefit of the support that CASA provides, which is leading edge and really does transform the communities that we live in.
And the reason that's so important is that we have this missing middle where so often those treatment locations are not available. And those are going to be live-in treatment centers for kids who need the opportunity just to settle a little longer, stabilize a little more before they can go back to their communities. Philanthropic support makes a huge difference to CASA Mental Health and the kids we serve. In fact, I say every day that we couldn't do it without our donors.
We have a government that is doing a tremendous amount of work to support mental health and youth mental health. It's not enough. We need to all be coming together as a community, and I know that there are a lot of donors who have helped support the work that CASA is doing and others. It's tremendously valuable. It makes a difference.
Because of donors, we've been able to triple the number of kids to almost 11,000 last year served. But it's not just the number, it's the story behind every one of those kids. And the truth is we see parents and kids on a regular basis, lives transformed as a result of our donors, as a result of donors like you.